You too. 2008, had an internal defibrillator implanted. What that does is if I go into cardiac arrest, it will give me a jolt to get my heart beating normally again. For me, at this point, there's nothing else they can do for my condition. It's as good as it can get at the moment, and I'm very stable at the moment. So, my last open heart surgery was in 2001. And from that surgery, they've done as much as they can to secure it and make it as strong as possible. So at the moment, it's good, but you just don't know what's going to happen. The one major thing that it affects is having babies. And so because of my heart condition, I have to be very, very planned, very prepared, very aware of all the risks before I attempt to get pregnant.
Jessamy and Julie have really been along the lifelong journey of Heart Children as an organisation itself.
Yet for kids like Matthew and Francesca, there's no reason why with the right medication and supervision they can't still be active. Today, Lara is happy to see that Francesca is looking forward to attending Heart Camp.
And last year, in January, at Camp Brave Hearts was the first time that I met her. She hadn't known any of the 68 other children that arrived at Camp Brave Hearts that day. But within a very, very short space of time, she had connected.
Camp Team Beat and Camp Braveheart are national camps organised by At Heart, where children come together to build peer support networks and share experiences in a safe, non-threatening environment.
I've met heaps of people. The first time I went to the Heart Camp, I was really scared I wouldn't know anyone, but they were all really nice. And because we went around on the first day telling each other what their condition was. I don't think anyone had the same one in my cabin as me.
She's a gutsy, happy, bubbly child, and anyone walking down the street would not look at her and think she's pale and sickly. She's growing, she's learning, she enjoys life, she has a sparkle about her.
1, 2, 3. I'm here as a volunteer adult helper at Camp Team Beat. The camp is really important because it's an outdoor pursuits camp. It gives a whole lot of these teens opportunities to do things in a safe environment, things that they would possibly be able to do at school camps, but they don't necessarily feel so safe and secure doing these sorts of outdoor activities at school camps because the instructors and the teachers and things don't necessarily know how things are for them. And you know, here if they don't feel like going in the water, we're not going to force them to go in the water. We understand why they're freezing and we understand why they need to go and sit down and all of that kind of thing.
Every week, 12 babies are born with a heart condition in New Zealand, and New Zealand children also face the threat of developing rheumatic fever. Nigel Wilson, a paediatric consultant, specialises in rheumatic heart disease.
The majority of children's heart units in the Western world are dealing with congenital heart problems, but in New Zealand, because we've got rheumatic fever, we have a number of operations per year that are to deal with rheumatic heart disease.
There are high rates of rheumatic heart disease in Māori and Pacific Island communities. Those specifically at risk are school-aged children.
What we find today is that, in fact, Pacific people have the highest rates and Maori the next highest, and people of European ethnicity have very, very low rates.
Tanya Makasini had 5 healthy children until her daughter Suliana contracted acute rheumatic fever, which developed from a sore throat.
Suliana born healthy child, never been in the hospital. The first time she was in the hospital when she had a heart problem. We only stay in a 3-bedroom home, but we got 5 kids, plus me and my husband, we got 7 in the house. And it's a cold house. She had a sore throat, and I take her to the GP. And just send us home with a Pemo. And I give the Pemo to her and the pain's gone. And after about 4 months, it's come back again. And I take it again and they say there's nothing wrong with her. Just give her the Pemo. The pain come back again, but it's not on her neck, but it's on her stomach. But that time, the pain was really bad. From my experience, when I look at my daughter, it's not like Suliana. So I take her to the GP. The doctor looked at her, and she said, you take your daughter to Middlemore, because her heart is beat very fast for her age. So we rushed take her to the emergency in Middlemore, and that's how they found out. She got a rheumatic fever.
I felt really scared when I went inside the hospital. There were heaps of nurses taking patients everywhere. Then I was scared that I might be like that too.
They take us on that night to Starship. As soon as we get there, Dr. Tom from Starship, they have to take her down to the feeder because Suliana's got a pneumonia and on her chest, and she got a fever, and it's got the fluid in her heart. And I thought that Suliana not make it to the next day. And that time, she hardly walk, she can't walk.
I couldn't move, and every time I moved, it felt really sore. I couldn't lie down flat on the bed, so the doctors told me to just sit up and just lie on the bed and just rest.
So they told me they're gonna take her down to the feeder, and they're gonna remove the fluids from her heart. And she keeps saying to me, Mom, I don't feel I can make it. I know that all the mothers, they can't stand, they can't hear that from their own child. And I said to Suliana, be strong.
The damage to Suliana's heart could have been prevented if she'd been prescribed penicillin to kill the sore throat bug.
Acute rheumatic fever follows usually from a sore throat when there's been a germ called the streptococcus, and we shorten that called the strep throat. And then 10 days, 2-3 weeks later, the body seems to react and get swollen joints, a bit of a temperature, and sometimes a bit of a rash. Those joints go away, the sore joints respond to aspirin very easily, but unfortunately the heart is the one problem. When they get inflammation of the heart valves, that can lead to permanent heart damage. If you're in the high risk group for rheumatic fever in New Zealand, then you should have throat swab, and then if it comes back positive for strep throat, then you would start with 10 days of oral penicillin.
Although Tanya took Suliana to the doctor on numerous occasions, her sore throat was not swabbed to check for the streptococcus bug that causes rheumatic fever.
And when I look back, they give Pemo all the time. And I was thinking, if the first time I take my child to the GP and they give her treatment that time, I don't think that Suliana came with the heart problem.
Suliana's heart valves had been severely damaged and she spent 6 months in hospital.
One of her valves is very damaged, it's leaking. So they had a repair, leaking valves. But they done it, but it's not 100% how it used to be, but they done a good job, and hopefully it's going to stay that way.
In order to prevent any further damage, Suliana must get penicillin injections every 28 days until the age of 21.
Hello, Suli, how are you?
Long-term penicillin. That has been shown, beyond doubt, to reduce the chances of recurrence to a very low level. You have one episode of rheumatic fever, the heart may be a little bit involved, but if you have recurrent rheumatic fever, then each time the heart gets worse. You get more and more scarring in the valves, and the heart gets bigger, the valves don't work so well, and those are the children who might need heart surgery, or they may just go along and need heart surgery as an adult. So it's that recurrent rheumatic fever which is so dangerous.
So although Suliana is not keen on the injections, she and her mum know that it's going to help prevent any further heart damage.
And then that's you for another 28 days.
For nurse Beryl Carr, Suliana is just one of many patients with the same condition.
We have a high proportion of incidents of rheumatic fever out here in South Auckland, and we do give the prophylactic injections to a large amount of children. Probably we might have 300 at our base on our books.
It's a no-brainer that prevention of rheumatic fever is cost effective. My research is involved in echocardiography, and that's using small echo machines the size of a laptop, and we are going into schools and picking up undetected rheumatic heart disease. Sometimes you don't get that sore joints, you don't get that acute illness. In fact, you have to have really bad heart disease before you get symptoms. Our first study in the South Auckland group, we found that over 2% of children, in fact, had evidence of undetected rheumatic heart disease.
Suliana, who is now well enough to play netball, is also doing her best to live as normal a life as possible.
People who have heart problems, I'll tell them to go to the family doctor, and then they will help them and tell them what to do.
If one of your kids had a sore throat, I think it's best for you to take to the GP to be head tested, make sure everything's clear.
Supporting local content so you can see more of New Zealand on air.